We're learning President Trump is planning to unveil a new health care proposal. And at this point, we're still waiting to know exactly what's in it. But we're told it could include a temporary extension of the Enhanced Affordable Care Act subsidies, which are due to expire at the end of the year. They were at the center of the government shutdown. However, the subsidies could come with some fresh guardrails that could include new income limits and a requirement that everyone pay some form of a premium. Now, we should note that if the subsidies do expire, millions of Americans are expected to see their premiums more than double next year. Zach is joining us now. He's a professor of health policy at Yale University. Zach, thanks for being here. As I noted, we are very much still waiting for specifics here. I'm sorry, this has actually been, sorry, Zach, we're getting breaking news while I'm talking to you. I have learned that the White House has postponed its expected unveiling of this new health care proposal. It was expected to be unveiled today. We'll learn more, hopefully, about that in the coming moments. But again, this is postponed, but we can talk about the ideas here. Zach, we just outlined some of the things that could be in there. It could also likely include an option for some people who choose these lower tier plans to receive some federal aid as well to help pay for that plan. So just what are your thoughts initially in some of these ideas?
Yeah, I was just happy that President Trump entered the chat, right? Healthcare costs are crushing folks who are out there across the country. If we don't see these subsidies come into play, what we're going to be seeing is a couple who's 60 years old, earning $80,000 a year, paying $30,000 for their insurance premiums. So I'm just glad we're starting to talk about it. I think it's pretty concerning that we're going to see this pushed again and again. I think it shows that, frankly, we haven't been engaging with this on a really serious basis. Like, what we haven't been talking about is why are costs in this country so high and what we can do about them.
Why are they so high?
It's the prices. And I think that's been this sort of real backdrop to the subsidy debate. What we've really been talking about is how you subsidize health insurance. It's like saying, if a hamburger was $300, how do we subsidize it? What we're not talking about is why the hamburger is $300 in the first place. So we've really never had bipartisan, serious conversations about the cost of healthcare. And one of the challenges is another way to talk about healthcare spending is to say it's $1 of somebody's income that's out there. And we're not good at doing government interventions, introducing policies that make a whole lot of folks better, but might take away income from other folks who are out there in the country.
Yeah. And so in terms of trying to actually put into place policies that would make things better for people out there, Americans, that would drive down their cost, what might some of those be?
So we need more competition in healthcare. One of the things that's happening nationwide is hospitals buying up other hospitals, and that's raising the price of care. We see hospitals buying up physicians. It's raising the price of care. We see a lot of stuff happening with pharmacy benefits managers. It doesn't bring benefits to patients, but it makes care more expensive. Those are the types of conversations we need to have. We need to be subsidizing insurance. I think that's going to get folks coverage. It's going to allow us to have those bigger conversations about healthcare spending. But we really need to be talking about the root causes of rising costs right now.
So it sounds like, from what you're saying, as someone who studies this whole system, that first you essentially have to continue to subsidize because the price is what it is at this point, and it's too high for many Americans out there. And then after you've done that, then you need to really get in there if you're Congress and the president and actually make some real changes to the system to include more competition and ways to bring down the prices.
That's exactly right, Jessica. And I think that's why folks are so frustrated out there. I think folks know the price of healthcare is too high. What we're talking about with the subsidies is the insurance for 20 million people. There are 150 million people out there who get health insurance from their employer, and they're feeling all sorts of trouble. And in a sense, what we want to say is, look, let's have these bipartisan conversations. Let's talk about the cost of healthcare. Let's make sure that people aren't priced out of health insurance, and see if we can get us on a glide path that's more sustainable going forward. So I think it's great that President Trump leaned in. It's a little worrying that the Republican Congress pushed back so much that they basically delayed this proposal and are just kicking the can down the road one more time.
Yeah. And there's also this idea that the president's talked about several times publicly, unclear if it would be a piece of this, but where he essentially says, let's give people federal income to help them purchase some of this insurance or give them money, some of these lower tier plans. But essentially, oftentimes people who get those lower tier plans are the really healthy individuals that maybe don't need as much insurance or don't think they need as much insurance. What's kind of the balance of those healthier people being in the pool with the people who might need to use the healthcare system more?
Yeah, I mean, I think there have been a lot of conversations out there, different policies, and I think what you're seeing is, remember when he was talking about in the debate, the frameworks of a plan. I think we need a real plan, and we need a real plan that says insurance is really expensive, let's subsidize it for the people who can't afford it, and let's have a real conversation about how you lower healthcare costs in this country. We spent months with the government shut down debating subsidies. What we weren't talking about is what are meaningful bipartisan reforms that can make healthcare more affordable. That, I think, is what's going to take some of the pressure off the American public out there who's saying, look, healthcare is making it harder for me to live a life of dignity and purpose. That's why folks, I think, are so frustrated out there in this country right now.
Let's get the thoughts of Dr. Ezekiel Emanuel. He's a former Obama administration health policy advisor and the architect of Obamacare. He's also the vice provost for global initiatives at the University of Pennsylvania and the author of the forthcoming book, Eat Your Ice Cream, 6 Simple Rules for a Long and Healthy Life. I do appreciate that advice, sir. Thanks so much for being with us. Obviously, the Affordable Care Act was passed more than 15 years ago, and it remains controversial. Millions of people who weren't previously insured now are, but healthcare remains a huge financial burden for millions. So how do you weigh its impact?
Well, the Affordable Care Act has been a huge success. As you say, more than 24 million people have gotten health insurance. We went from an uninsured rate of roughly 15-16% down to an uninsured rate of 8%. We've also kept healthcare costs flat as a proportion of the GDP from roughly the time of the Affordable Care Act to 2023. The last few years, it's gone up substantially. Now, it is the case that Americans are suffering. We have an affordability crisis. Even when we were passing the Affordable Care Act, I said we've got to emphasize controlling healthcare costs. We put a number of provisions in, but more has to be done. So I think that is definitely true. The American public feels the pain of rising healthcare costs, rising drug costs, rising insurance premiums and copays and deductibles.
Let's talk about the subsidies that are set to expire, because they're going to be the crux of this upcoming fight. Why was it necessary to provide those subsidies during the COVID pandemic, and why were they structured to expire now?
Well, they were important to get as many people insured as possible because we wanted people who got COVID or suspected COVID to test themselves if they had COVID and were sick, to go to the hospital and not avoid getting health care because of cost. That was the main reason. And we saw, in fact, in 1 year, I think something like 7 million more people got health insurance because of the enhanced subsidies. So again, they were very effective in the goal of getting people coverage so that they would not avoid getting healthcare services. They were set to expire for financial reasons because they are expensive as healthcare is expensive.
So if the idea partly was that having millions more people get healthcare would help drive costs down, why are they remaining unsustainable for so many people?
Well, there's a lot of reasons why they're going up. Probably the main 2 or 3 drivers of rising healthcare costs. One is hospital costs have gone up way faster than any other single part of the healthcare system. Hospital costs rising. They're now about a third, just under a third of all healthcare spending are related to hospitals. You have drug costs where the average price is going down, but new specialty drugs are super high, and people understand this from the GLP-1s. The prices could and probably have to come down. We also have some perverse incentives in the system. We pay doctors to do more rather than to keep people healthy. We have administrative costs that are at 20% of total healthcare spending, way too high by anyone's estimation. So there are a number of factors driving healthcare costs up. and the public is experiencing those problems.